Transcranial direct current stimulation, or TDCS, is an emerging method of treatment in patients diagnosed with schizophrenia, Agarwal 2015. TDCS is a non-invasive brain stimulation technique that allows for modulation of brain stimulation and connectivity. By using low-voltage electric currents between 0.5 and 2 milliamps, one anode and one cathode are typically placed on selected brain areas. Brain excitation increases near the anode and is reduced near the cathode. One major positive symptom in schizophrenia is auditory visual hallucinations. TDCS hopes to aid in the symptom reduction of AVH, George 2009. Brunel's study uses TDCS on 30 schizophrenia patients by placing the cathode of the left temporoparietal junction and the anode on the left dorsolateral prefrontal cortex, and uses one daily 20-minute session at 2 milliamps over 5 consecutive days, reducing excitation and therefore minimizing the number of hallucinations. This study found a significant effect between TDCS and AVH, and a 36% reduction on the AHRS scale at 1 month and 38% at 3 months, suggesting long-term effectiveness. However, larger sample sizes need to be recorded for further development. Hoy and colleagues conducted a pilot study focusing on negative symptoms such as cognitive deficit. The randomized sham-controlled design had participants sit 3 20-minute treatments either at 1 milliamp, 2 milliamp, or shammed. The two-back working memory test was then performed 20 and 40 minutes post-stimulation. In a study by Molondaise and colleagues 2014, 1 milliamp was enough to evoke a significant response in younger children aged around 14, suggesting age and weight in relation to amplitude of treatment. Results found that the 2 milliamp voltage enhanced performance of the working memory over time. This study provides support for the use of 2 milliamp TDCS treatment for enhancing cognitive function in patients with schizophrenia. One theory hypothesized by Hassan and colleagues 2011 discusses the concept of disturbed plasticity, abnormalities stemming from glutamatergic NMDA receptors. The objective of this TDCS treatment was to study non-focal LTP-like plasticity in schizophrenia, specifically duration and severity of psychosis. Results identified that schizophrenia patients with multiple psychotic episodes displayed significant LTP-like plasticity. Across all schizophrenia patients, significant cortical disinhibition was identified. This discovery leads to potential studies with relation to neurodegenerative processes of plasticity in schizophrenia. From the research identified above, TDCS is on its way to becoming a potentially effective treatment modality in patients suffering with schizophrenia, with the ability to indicate signs of symptom reduction, cognitive function, and the development of neurodegenerative processes. More research needs to be completed in this field, including long-term studies, effectiveness on positive and negative symptoms, and monotherapy and its combination with cognitive training. Larger sample sizes are also important in increasing the validity of the research being conducted.